Hi guys, my name is Jesse Wright and I'll be speaking on the ethical issues of death and dying in the epilogue chapter of our textbook. So just to preface, the worksheet that I provided you with, just follow along. It's just going to relay the terms and concepts from this portion of the chapter. And so just to start off, when we are looking for signs of death, it used to just be that we would look for the stopping of a heartbeat or the breathing. Um, and so if they weren't breathing and they didn't have a heartbeat, they were presumed dead. Now it's different. We look for the brain waves of someone, and so that's what declares someone dead. Um, and so there are four types of things of where people might appear to be dead, but they may or may not be, or not yet. The first one is called locked-in syndrome. So this is when a person cannot move. They can move their eyes, and normal brain waves are still apparent, so this person is not dead. The next one is called brain dead. So this is prolonged cessation of all brain activity with complete absence of voluntary movements. So they don't breathe. There's also no response to pain, noise, and other stimuli. In this situation, the brain waves have ceased, so that this person is dead. The next one is called a coma. So this person is in a state of deep unconsciousness from which the person cannot be aroused. Some people awaken spontaneously from a coma, but others may enter into a vegetative state. So when a person is in a coma, this person is not yet dead. In a vegetative state, this person is also in a state of deep unconsciousness in which all cognitive functions are absent. Although their eyes may open, sounds may be emitted, and breathing may continue, this person is not yet dead. Um, a person in this state can be transient, persistent, or permanent, so there's no way to figure out how long they will be in this state. No one has recovered from being in a vegetative state after 2 years of being in one, but for those who do, which is about 15%, will improve within the first 3 weeks. And after sufficient time has elapsed, a person may effectively be dead, but doctors don't know exactly when to determine at that point, are they dead or not. So the first topic that I want to talk about is euthanasia. So passive euthanasia is when a person is allowed to die naturally instead of intervening with attempts to prolong their life. This can be written into their advance directive as a DNR or do not resuscitate order. And it's just a form that's saying doctors should not attempt to revive their patient by extraordinary measures like a defibrillator to restart their heart or mechanical breathing. On the flip side, there's also active euthanasia. And this is when someone does something that to hasten another person's death or just to speed it up. Some physicians condone active euthanasia when three conditions occur. This is by suffering cannot be relieved, they have an incurable illness, and the patient wants to die. This type of euthanasia is legal in the Netherlands, Belgium, Luxembourg, and Switzerland. It is legal elsewhere. The doctor's role in this type of, in euthanasia, they are allowed to do physician-assisted suicide, which is a form of active euthanasia. The doctor prescribes lethal drugs to help a patient end his or her own life. This is a controversial issue of where people may not think that this is appropriate, but there's also people who think it is to end suffering. So even the name has been kind of changed from physician-assisted suicide to death with dignity as to not include the suicide aspect. This has less to do with a person's experience or their personal experience rather than to do with religion, education, and local values. The next part is called wills and proxies. To start off, advanced directives, which is just a description of what a person wants to happen as they die and after they die. So this includes medical measures, visitors, funeral arrangements, and cremation. It also includes living wills and healthcare proxies. A study on cancer patients shows that only 16% had living wills and 48% of them had as a designated proxy. A living will is just to show the medical intervention a person wants or doesn't want if they are unconscious, like in a coma. But if they do happen to wake up and they're conscious and lucid, they can choose to override that living will. Um, Now, a healthcare proxy is just a person who they have chosen to make medical decisions for them if they're unable, like if they're in a coma. Last semester, my grandpa had an aneurysm and he was rushed to the hospital. And what an aneurysm is, it's just bleeding in the brain or in the skull. Uh, Now, when my grandpa got to the hospital, he um, his brain bleed had shifted his brain and it caused impairments to his eyesight, his cognitive abilities. His whole right side of his body would be unable to be able to move. Um, he would not be able to be he would not be able to do a lot of things that he wanted. My grandpa is a very independent person, and so my mom, as his designated healthcare proxy, decided that it was probably be best for him to slip through passive euthanasia and die naturally. Um, Now, doing that, the doctors made sure that he was very comfortable, that he wasn't feeling any pain. Um, they gave him morphine to ease his body. Um, and so my mom knew that he would not want to live a life needing so much help from other people. He was a very independent person. He liked to do things for himself. He lived most of his life alone um, and just doing things for him. So we decided that it was in his best interest to pass away rather than prolong his life and having to live a life dependent on others. So the questions that I want to go over are true or false. A healthcare proxy is a person who uses their own feelings and values to decide what should be done regarding the medical decisions of another. We just went over this. It is false. A healthcare proxy is a person who they have chosen to make a medical decision for them if they're unable, but to do it in a way that they feel is best for them. What are the 3 requirements that allow someone to engage in active euthanasia? Um, it is the suffering cannot be relieved, there's an incurable illness, and a patient wants to die. So that's the end of my presentation. I did leave 2 links to YouTube videos that if you want to learn more about healthcare proxy, and there is a crash course about the philosophy of assisted suicide. Thank you guys, and have a great day. Bye.